This is my audience. Did you know that over 57.8 million people a year suffer mental health issues in the U.S.? This topic is relevant to the integral overall being, impacting how we think, feel, and act, and influence our ability to cope with stress, build relationships, and achieve our full potential. Today, I am going to inform you about why and how mental health is affecting the lives of U.S. citizens and how we can resolve that issue. I feel confident in my authority to share and talk about this because as someone who has struggled with mental health a lot in the past, being a major factor in my life, first, I will tell you about mental health statistics and how it is caused. Then I will explain who it affects. And then third, I will tell you the resources and support out there that can help. First, I'm going to tell you about mental health statistics and how mental health is caused. Mental health is a major factor in human life, whether people admit it or not. Everyone struggles with mental health at some point or time in their life. But what exactly is mental health? Mental health is a state of well-being that enables people to cope with the stresses of their lives, realize their abilities, learn well, work well, and even contribute to their community. Mental health is to be considered the highest health issue in the world. According to the World Health Organization, in 2019, 1 in every 8 people, or 970 million people around the world, were living with a mental disorder, with anxiety and depressive disorders the most common. Mental health is so highly caused in humans that the world is in need of more therapists and doctors who specialize in psychology or psychiatry fields. According to the Zebra, mental health crises account for 60 million visits to primary care and 6 million ER visits annually. This just shows how there were over more patients every year for mental health compared to any other health issue in the world. Mental health treatment rates is something that is highly talked about when mental health is mentioned. According to the National Institute of Mental Health in 2022, among 15.4 million adults with SMI or 10.2 million received mental health treatment in the past year. Not only should people receive treatment if experiencing mental health issues, but if they don't, they could end up with life-threatening effects. Roughly 2/3 of Americans with a diagnosed mental health condition were unable to access treatment in 2021. Though they had health insurance, and only a third of insured people who visited an emergency department or hospital during a mental health crisis received follow-up care within a month of being discharged. Mental health can be caused through biological health factors. These factors can be through alcohol and drug abuse, smoking, unhealthy diets, and lack of physical activity. According to Martha Ann and WebMD, mental health illnesses sometimes run in families. If you have a family member with a mental illness, you could be more likely to have that. This risk is passed down through genes, and you inherit from your parents. Another mental health cause can be due to psychological issues. These issues can range from body image, gambling, hearing voices, stress, stigma, and even discrimination, along with trauma. There are things like psychologists and psychiatrists that cost lots of money to get into to see if you're suffering from these issues, because few people can actually help who suffer these issues and have knowledge to what they are talking about. Now that I've told you about the statistics and causes of mental health, I will now tell you about who it affects. Most people think that people are equally affected by mental health, but in reality, gender and types of people are more affected by mental health issues. While mental health occurs in everyone, it is statistically proven that mental health problems are more seen in teens and young children. This is mainly because they're going through a lot more changes in their life and their body and etc. It's like schools, relationships, sports, and other things. According to the National Library of Medicine, nearly 20% of children and young people ages from the age 4 to 17 in the United States have mental, emotional, developmental, or behavioral disorder, and suicidal behaviors among high school students increased more than 40% in the whole decade before 2019. Mental health challenges were the leading cause of death and disability in this age group. It is also proven that women are more likely to experience mental health issues rather than men. According to the News Medical Life Sciences, women have a significantly higher frequency of depression and anxiety in adulthood, while men have a larger prevalence of substance use disorders and antisocial behaviors. Women also have a higher prevalence of depression and anxiety disorders due to genetic and biological factors. This shows that gender can play a big role in mental health issues. While anyone can suffer from it and have a higher toll on a different gender. Mental health can also have a toll on college athletes, as said by the Zebra. 25% of college athletes struggle with mental illness, and 10 to 50% of all athletes experience psychological issues, which is severe enough to warrant counseling. Athletes may also struggle with mental health more than others because not only are they dealing with college schoolwork, but they're also dealing with practices, games, making sure they're making time for themselves in general with all of that going on, which can cause stress and overthinking and even overwhelming at that time of point. The mental health of regular college students is probably one of the biggest areas of adolescence that are affected by mental health effects. According to American Psychological Association, College students today are also juggling a dizzying array of challenges, from coursework, relationships, and adjustment to campus life to economic strain, social injustice, mass violence, and various forms of loss related to COVID-19. This proves that college students go through a lot of trouble trying to balance their overall mental health while trying to just be their own in a college area. Now that I've told you about the statistics and causes of mental health, along with who was affected by the mental health, I'm going to inform you about what the support and resources there is to resolve this issue. Now that we know what mental health is, what causes it, and who it's affecting, we can start to talk about how to solve this epidemic issue and how people can find a solution to their issues with mental health. Many people don't know that there are programs out there specifically for mental health. This may be caused because it isn't promoted or talked about very much, and I feel that this is an issue why mental health isn't ever going away, simply because we don't take action or promote it to the action that is being caused. It is said that 50 to 70% of Americans don't receive mental health support from programs simply because they don't even know where to start or who to reach out to, or simply because they don't have enough money to pay for it. People should be able to feel comforted in who they can reach out to, especially when they are struggling. According to Statista, there are over about 12,000 programs for mental health, and over 50 million people are benefited from their mental health issues. Big mental health programs that you might have heard are Veterans Crisis Line and 988 Suicide and Crisis Lifeline. If someone is too scared to go through a program for mental health, they have other things like individual people who can help as well. This may be a better solution for people who don't like exposing their problems to everyone and instead to one individual. Therapists may be a good way if you are someone who doesn't like to talk to someone you know very well. A therapist is just simply someone who can talk to you and can't tell anybody else about what your problem is. It is good to talk to someone for another opinion or for help that isn't someone that you might know. It is proven that about 75% of people who undergo some type of therapy see a benefit from it. If you need more than just a talk from someone, you can go see a more experienced doctor like a psychiatrist. A psychiatrist can act like a therapist, but they can prescribe you medication and make you plans to help you for issues or mental disorder you have been diagnosed with. They can also be very good if you're struggling with more than just mental health issues, but disorders as well. According to Bureau of Labor Statistics, there are about 40,000 psychiatrists in the world. That doesn't seem like a lot, but is a lot more than you think, especially when they help about hundreds of people every year with mental health issues. Today, I've discussed mental health and how it affects the well-being of people worldwide. We've talked about the situations that cause the problems of mental health issues, how it's affecting people's lives, and how we can prevent this issue from happening. As people in the world evolve, it is important to remember that every person has feelings that is important to be aware of, and you never know what someone is going through. So always be vigilant what you say or do to someone, and to notice if someone is struggling and not just be a bystander, but instead be someone who will help.